Okay, so TJ's going to be helping me so I can show you how to put the face mask on. But firstly, the most important thing is that you have your machine set up and ready to go. So in the past, my background is in intensive care nursing, and often I would have my machine ready, put it on. If I needed to readjust it, I would readjust it. I wouldn't often stop the machine before. However, now the crucial things that you need to know is that your machine needs to be ready. You're going to put your face mask on, you're going to tighten it and get a good seal, and then press start. If you need to readjust, you need to stop the machine, readjust the mask, and press start. If you need to take off the machine, you need to stop the machine first and then take off the mask. So it's really important that we reduce the amount of aerosol in the atmosphere if we can. So first of all, what we're going to do is we've turned the machine on. So now I'm going to show you how to do your learn circuit. A learn circuit is really important because it enables us to check that the machine is safe. So first of all, you come to this screen and you're going to unlock. You press the middle button and the 2 ticks and you hold down for 3 seconds. It's really good to make sure you only unlock for 5 minutes because you want to make sure the machine is locking again and that it's safe, and then that way no one can adjust your settings. So when you come to the home page, you have a ramp, a face mask and a learn circuit. The most important thing to do first is your learn circuit. So your settings your equipment needs to be set up with the face mask and the HME filter, because the learn circuit not only tests if it's safe to use, it also checks for the dead space. So then you know that the ventilation observations that you're getting are just from the patient and it's nothing regarding the ventilation tubing. So all you have to press is start. It's very easy. You just press start and then it does it for you and it'll let you know if it's safe. I would also always say if it fails the first time, check all your equipment, make sure that it's all on tightly and it's all on the correct way, and try again. If it then fails again, then look to get new equipment and see if anything is faulty. So we'll just wait for that to complete. It only takes a minute or so. You should do this in between every patient and any time you change the ventilator tubing. Okay, so it's come up with a happy face, so it means that it's safe to use and we can now use the ventilator tubing. So the first thing you can do is check your mask type. So you move this spinny thing here, you click on it and it says full face. We should only be using full face. There are settings for paediatric and trachea. However, in an adult setting, we should only be using the full face mask unless a consultant has said otherwise. Okay, so now we're going to go to the settings page. So the settings are just here, the 2 double ticks. Our mode, you can change that by clicking here. It will turn orange and then you can decide which you would like to do. If you want NIV, it is ST mode. If you want CPAP, it is CPAP mode. The page is quite easy. There's only one setting to change, so it's your CPAP. Patients have been recommended by NHS England that we should be doing a CPAP of 8 to 10. However, I would recommend starting at 5 because we don't want the patients to rip off the mask because they're uncomfortable. It's really important that we're making it as comfortable as we can for them. So if we start at a low peak of 5 and then slowly increase it, they're more likely to get used to it and more likely to be happy with the machine because it can be really uncomfortable. The next setting is advanced settings, which really aren't advanced. So we have our triggers. The trigger is basically letting the machine know when the patient is inspirating and expirating. So it's giving them an idea so they can understand when to put a backup rate in. It's not really needed for CPAP, however, it's still there. So please just set at medium unless a respiratory consultant or registrar say otherwise. The next thing you can also do is the face mask, which we've already set on the front screen, so we don't need to change. I did forget to say, sorry, on the CPAP, this goes up in points. Please don't go up in points. Just go up 5, 6, 7, 8. However, please do not change the settings unless you feel comfortable to or you are trained. Speak to a consultant or a respiratory registrar before. On our next page, we have our alarm settings. A lot of these alarm settings, you may be unaware of what the normal limits should be. Don't worry, we're not expecting you to. But just make sure that all your alarms are on, and if you're concerned that they're not on, speak to one of the nurses who's trained or one of the doctors that's trained to ensure that the limits are set tight. We need to make sure the limits are set in the right manner because we don't want to be going into rooms if we don't need to, but we also want to be going in if the patient needs help or if the machine is not working properly. So we can go the whole way down and you have minute volume, respiratory rate, peak pressures and apnea, and you can pick that yourself. On the last setting page, We have the ability to do the learn circuit, so if it doesn't come up on the front page, you can go through the settings to find it. And we also have ramp up and ramp down. These settings are really important for comfort measures for the patient, especially as we want to keep the mask on at all times while the machine is running. It's really important that we do the ramp up and ramp down for patients if it is appropriate and if they're clinically well enough for this. Normally, as a nurse in respiratory, when I start NIV or CPAP on patients, I would be showing them the mask and letting them feel the air, putting it to their face so they can feel what it's going to be like. However, because of COVID, we're unable to do this, so it's really important. It's really important that we're making it as comfortable as we can for the patients, so they're more likely to be able to tolerate it. So by doing the ramp time, if you're doing it up, it means that you're slowly increasing the PEEP, so the patients can get used to the new adjusted. Your normal intrinsic PEEP is 2 to 3, so to suddenly go up to a 10 is a massive jump, and patients might find that extremely uncomfortable, so they're more likely to pull the mask off. So if you do a ramp up, at least that gives them time to get used to it. Also, if you have patients that are on a PEEP of more than 10, this is actually very high and it can be deemed as a high PEEP. So it's really good to do ramp down as well, because if you're taking a face mask of someone who could be quite dependent on it, their saturations may suddenly just plummet. So it's really important that you do ramp down as well for these patients if appropriate and if you can, because it would just allow their bodies to get used to that PEEP slowing down. The ramp time can be anything from 5 to 20 minutes. So that is your free settings pages and that's your machine setup. The last page I'll show you is here, which is your observations. So this is really important because you're able to get your tidal volume, your minute volume, how much the mask is leaking and your respiratory rate. So it's an important page, and if you're interested you can look at the waveforms as well. Okay. The last button down here is just an information button. It can be quite handy if you're busy because you can look and you can see when anything has been adjusted or altered. So you can see that I've just done a learn circuit. It will also tell you for any alarms and any changes to the machine. So our machine is now set up, so we will now place the machine on my lovely volunteer. Okay. So I can see here TJ's got good skin, so I'm not concerned that his skin's going to break down. He hasn't got fragile skin. However, that doesn't mean his skin won't break down. So it's important that we're doing regular mouth care, eye care and pressure care. So first of all, I'm going to put the mask over his face and I'm going to place it here. It's really good if you just get a seal of where you're putting the mask and then do it. If it's your first time doing it, I would recommend doing it in 2s because it can be a bit hard when you're not used to doing it. So you're going to put it in both ways here and then you're going to tighten. You don't want it to be too tight, but you want it to be tight enough that you're going to get a good seal. So it might be practice, it might be that you start the machine, you can see there's a leak, you stop the machine and you readjust it. A good thing to do, I know it's hard with gloves, but if the machine is leaking, feel around, find out where the leak is, so then when you stop the machine, you know where to readjust. Okay, comfortable?